Dr. Roberts on the Morning Crossfire Health Thursday, and we had a very lengthy conversation as regards the brain drain in the country. What is happening, to the medical professionals who are leaving this country in droves. I had intended to bring you the repeat of that broadcast, but I think that if you missed out on that show, please go ahead and listen to it again in our podcast session on our website, nigeriainfo.fm, or just go and watch on our YouTube channel, Nigeria Info 99.3. Like I said, I had intended to play this edition back to you again this morning, but on the other hand, I thought maybe it's something that we need to talk about, like you and me, and let health professionals themselves even join this conversation. They're listening to us right now. Even join this conversation, because last week I couldn't even take as many calls as I would have loved to, because there was so much that Dr. Roberts shared on the show. For instance, she talked about out of every one doctor that leaves the shores of this country, 10 nurses leave as well. That's how bad the situation is. So we're just focusing on the doctors alone. And Dr. Roberts said, last week that, look, there is no medical services without the nurses. So if you have 10 of them leaving, out of every one medical doctor that leaves, 10 nurses leave. That's a bigger problem that we're not even... it's a conversation where we've not even started to think about, that we should be talking about. Now, are you aware of the kind of situation that we are in right now as a result of the brain drain situation in the medical sector, most especially in the medical sector? Not just the doctors alone, not only the nurses alone. There are other professionals in that sector that are also leaving in droves. So you see, we are in a very critical situation right now. Some days ago, it's still up to a week, where the federal government said that they are not going to allow doctors to leave again. They're going to try and stop it. And in my mind, I'm asking, how do you intend to stop it? Now the resident doctors are even giving you notice of strike. We've not heard anything concrete as to whether you're going to allow them to proceed on strike again. We've been here over and over and over and over again. Imagine a resident doctor who uses his own money. Imagine a consultant who uses his own money to treat a patient. Imagine medical practitioners who couldn't even afford a meal, and they are supposed to come to work every day to come and work. So I'm going to talk to you this morning. If you're a healthcare practitioner, please talk to me as to how your mind is working. Because I've related with quite a number of them. In fact, a doctor once told me that, look, for every doctor that you see in Nigeria, it's either that doctor is about to leave or planning to leave. That almost all doctors, nurses are leaving the shores of this country. And if you think that they're only going to Europe or America, think again. They are even going to African countries. Like African countries, like neighboring countries, anywhere but Nigeria. And like a caller said this morning, he couldn't figure out why we're so quiet about this, why we don't talk about this every day. In fact, I must confess, he inspired me to want to even have a direct conversation with you out there today. Because I was going to play the repeat, actually. I announced it at 5 a.m. that I was going to play the repeat due to popular demand, because quite a number of people who missed out on that chat with Dr. Roberts were saying that I should bring her back, And I said, okay, you know what? Instead of bringing her back, let's play the repeat of what she said. So it wouldn't be like she's repeating everything that she had said before. But when that call came in earlier in the morning, I was like, okay, look what, let's talk about this issue. Let me even hear from the players in this sector themselves. If you've been to the hospital, especially public facility, any public facility lately, I would want to know your experience. 0700 993 993 993 and 01465 71904 for the ladies. It's one thing for you to expect the best from our health facilities out there. It's another thing for those facilities to aid these practitioners to give you the best. If there are no enough infrastructure, equipment, things that they need to use, their tools to take care of you, what do you think they're going to do? Still give you the best? Because I know the complaints that I get anytime we talk about doctors and nurses. I know those complaints. Yes, they are valid complaints. But have we looked at the underlying factors? Here we are now. Our healthcare practitioners are living in droves. In a hospital where you have like 15 people in a department, like in 5-6 years ago, go to that same department today. No, try it out yourself. Just try it out yourself. Go to that same department today and find out how many people are left. And not just the resident doctors, not the junior doctors, even consultants. The seniors, they are leaving. And we should keep quiet and not discuss this every day. Like Dr. Robert said last week, she advised everybody, do not fall sick. That's someone who works in the public sector. She said, do not fall sick. If you listened to her last week, I would love for you to share a few things that you heard as well. And I always say that as well. Like, don't pray. Don't try. Don't allow yourself fall sick. Okay. Let's hear from you now. 0700 993 993 993. WhatsApp is 0809 597 5805 on WhatsApp. We're streaming on Facebook. We're also live on YouTube as well. Nigeria Info 99.3. Brain drain in the medical sector. Lagos, let's talk. And please, we have a limited time for us to hear your thought, okay? So please manage your time very well. Good morning to you.
Good morning.
Morning to you.
Is this a Sheriff?
Yes, please.
Good morning. The name is Daniel.
You're welcome.
Yes, I'm calling in respect of the health sector issue we're discussing this morning.
All right.
It has never been this bad.
Hmm.
It has never been this bad. In fact, medical workers, pharmacists, doctors, nurses, everybody, they are making plans to leave. Because this government is not interested in the health. It's citizens. Are you aware that 5,000 naira is the
5 what?
hazard allowance
You said what?
of health workers?
Sorry, I didn't get that.
I say, are you aware that health hazard allowance of health workers is 5,000 naira?
But it's been increased. Hasn't it been increased?
Up to today, no implementation. It's just been
No implementation. Okay.
Yes, up to today.
You are a doctor, I guess.
I'm a pharmacist.
You are a pharmacist. Okay, talk to me now. No implementation.
No implementation. The Minister of Health promised 1st of December, announced 1st of December that it will be implemented. Up to today, they say 5,000 naira. And these are people that are exposed to different kind of hazards in the hospital. Now, how do you expect the workers to gain their best in this kind of situation? It is very, very bad.
I know.
I just say one day we'll have a government that will care for Nigerians, because it is the common man that is suffering this. It's the common man that is coming to these hospitals. Flight headache, all of them are abroad. God help us.
Thank you so much. Pharmacist Paul, is it Paul? Thank you so much for calling me, or Daniel, I can't remember. But thank you for sharing an insider thought on this. I would love to hear from other, healthcare practitioners out there, nurses, pharmacists, anesthetists, lab scientists, doctors. If you play in that field, I would really, really love to know. I mean, how your mind is working right now. Good morning to you. Good morning. Please turn off your radio and talk to me.
Hello?
Yes, morning to you.
Good morning.
Yes, please. I can hear you.
Yeah, this is Obiani Tuhu. I'm calling you from my two.
From where?
Obiani Tuhu from my two.
From my two. Okay, go on, please.
Yeah. You see, to be said, this Nigeria acknowledge their doctors and their nurses. I don't see the reason why they will be going outside for salary or one thing or the other. But because they do not regard, them.
I'm sorry, Ruth, your line isn't too clear, but I get what you're saying. Like, it's because we don't care enough about our healthcare practitioners. That's why. Even in where most of them are going to, it's not that they're exorbitantly being paid, they're being overpaid. No, they're not. Go and ask around. They're not. Doctors and nurses are not like overly being paid. It's just that the environment is conducive. Environment will want you to save lives because that's what they signed up for. The environment encourages you to take life very important. Take your job very important. Let me speak to Emmanuel, who is on Sky. Emmanuel, hi. Good morning to you.
Hello, good morning.
Good morning to you.
Yeah, Mr. Sheriff. Yeah.
Yes, please.
My name is Emmanuel Richard.
You're welcome.
Yeah, I'm a medical doctor.
And you're calling us from where?
Well, currently I am abroad.
Okay.
Yes. I left the country like 2 years ago. Yeah. The issue of brain drain is a serious matter. Mr. Sheriff. When I graduated from medical school, that's about 10, 11 years ago, I had decided that I'm going to work in Nigeria, train in Nigeria. Unfortunately for me, most of our colleagues who left the country, at that time, I remember there's one of my colleagues telling me that this country is getting bad. Just write your foreign exams and go. I say, no. I was trained here. I received subsidized education. Well, let me just give back to the community. But after 3-4 years of joining my residency program, I just realized that I'm just wasting my time because it is either there are no equipment to work with, or you are struggling with payment, or one thing or the other. Do you know that somebody just told you that hazard allowance is 5,000 naira? Yes, it is 5,000 naira. The government refused to implement it. Since 1st December, they said they're going to. They didn't do that. I had to write my exams and pack and left the country. The same year. In fact, let me tell you what made me to leave the country.
Tell me.
What struck me. At that time, specifically around November 2019, we lost our chief medical director of one of the hospitals where I worked. The man died because of poor health system. He died and he couldn't be taken care of. This is a CEO of a hospital. So what are we talking about? This thing can affect anybody. The government are not serious in fixing the health system. That is just it. They are not serious about it. And that is why doctors are leaving. Just take time and monitor those people writing exams. Go and see, you will see doctors in groups writing these exams. You'll be wondering what is happening. Thousands of them are writing exams.
The PLAB exams,
yes,
are they?
The PLAB exams. These exams are written in February, May, August, and November. Another one is coming in November 3rd. Just go there and see what's happening there. And see how Nigerian doctors are moving. Nurses are moving. Pharmacists are leaving. Everybody is tired of the health system. So I just feel that we're just joking, and not the Nigerian government are not ready to fix it. Look at the what I call it. One of my colleagues that died from COVID. Up to now, the person has not received anything from the government.
No compensation yet, up till now.
No compensation. Death in service. Nothing was paid. I had a chat with the wife just last month. Nothing. She didn't get anything.
That's unfortunate.
So, and this person died during COVID, and the government said they are going to pay. They didn't do anything about it. It just lip service. I'm just ashamed of what is happening.
Dr. Emmanuel, thank you for talking to me from abroad. Appreciate it. I'm going to go back to the telephone now in case you're just joining us. I'd like to hear again, I'd like to call out to healthcare practitioners, pharmacists, doctors, nurses, lab scientists, anesthesists. If you play in that field, I like to hear you. I'd like people to hear you. I like to hear how your mind is working right now. Are you planning to leave? Are you about to leave? You don't have any plan on leaving at all? 0700 993 993 993 and 01465 7190. We're discussing, medical brain drain this morning. Nigeria Info, good morning to you. Good morning. Good morning to you.
Good morning.
Yes, please.
Good morning.
Good morning to you. We can hear you.
Yeah. My name is Walter.
You're welcome, sir.
Hello.
Yeah, we can hear you. Please go on, Walter.
Can you hear me?
Yes,
yeah,
loud and
okay.
clear.
You see, this issue of doctors leaving, nurses leaving, now small thing, no. Do you know the worst thing now?
What's that?
Even morgue attendant, my friend who's a morgue attendant.
Who is a mortician? Your friend who is a mortician?
No, morgue. Those people that watch dead body,
okay.
Those morgue attendants.
We're saying something, but go on.
Yeah. 2 of them have left.
Oh, wow.
That is how bad it is. The one that we are even looking down on, those sectors, the people that we are looking down on that watch dead body, 2 have left this country. One is my very close friend. Do you understand?
I'm with you.
That is how bad it is. So it is not only the doctors, the nurses, the pharmacists, and which other ones again that are living in the medical sectors.
Right.
Even the morgue, those ones that are helping to carry dead body, to wash dead bodies, they are also leaving. Thank you.
Mr. Walter, thank you for calling me. Nigeria Info, good morning to you.
Hello, good morning.
Good morning to you.
My name is Edidiong. I'm calling from Okudu.
You're welcome.
I'm a nurse, and I am someone who's always said I don't want to live abroad. I want to live in Nigeria, be able to travel to wherever I want to, and always come back. But sometime last month, I started processing my NCLEX to travel to the US because it's not. If somebody actually has plans for themselves, they can't deceive themselves in Nigeria. As a nurse, how much do we earn? As a nurse, I wouldn't say common, forgive that. A registered nurse in Nigeria, on an average, would earn, if it's very good for them, 100,000 naira. How much is that? And how much would a registered nurse in the US earn? You said that they don't earn so much, but that's not true. They earn very well. A registered nurse in America could earn up to $10,000 in a month. And then how much they earn is dependent on how hard they want to work, right?
Right.
So
right.
Nurses are outnumbered. Like patients it's supposed to be ideally 5 patients to 1 nurse, but it's almost like the whole world to 1 nurse right now. So it's not like if you're thinking for yourself,
right?
There's nothing to remain in Nigeria for. There's nothing.
So, Edidian, you plan to leave?
I have only recently started working on that.
Okay.
I am someone who is committed to, patriotic to Nigeria.
I can imagine.
Very patriotic, but I have only just started to work on leaving.
All right. Thank you for talking to me, yeah?
Yeah.
And best of luck. Best of luck. Best of luck. Okay. We're streaming on Facebook. We're also live on YouTube as well. McDonald is calling us on Skype, but McDonald, you're going to make this very brief because of time. McDonald, hi. Good morning to you.
Hello.
Yes, good morning.
Can you hear me?
I can hear you now.
Okay, good morning. Yeah. Please, my voice may not be so strong. I'm calling from work.
That's okay.
At work right now. I'm calling from Toronto.ca.
Canada, okay. Okay.
Yeah. So, the other day I heard about here in Toronto, here in Canada, about shortages of nurses and health workers. And I began to wonder if A Canada with so many good schools and they're turning out students, if they are complaining of a shortage of worker. I'm a health worker, but I'm not up to that nursing and other things.
Okay.
I have my degree, but I'm still desiring to go back to, to acquire nursing certificate.
Okay.
Yeah, and Canada is complaining of shortages of workers. I now use it to compare Nigeria, whom is not caring about their own workers, and their workers are leaving because here in Canada, they need workers, they need nurses,
as many as they can get.
Nurses. So as many as. I'm a PSW. I don't know whether I understand. Personal support worker.
Yeah.
I'm at work right now. Yeah. And sincerely, I do make up to $7,000 in a month. We are like servants to nurses because we are not nurses. We are health workers.
Right.
You understand?
You are a care worker.
Why my country? Yeah, a care worker.
McDonald, let's leave it there for now, but thank you so much for sharing your thought. It's just that I need to step out now for a quick break, okay? Lagos, we'll return. I will talk to you some more. Stay here with us on Nigeria Info.
You are listening to your number one station for talk.
99.3 Nigeria Info.
99.3 Nigeria Info. Let's talk.
Shoprite's low price birthday boom is here with one of the best deals of the year. Buy any 3 Chivita 1 liter assorted juices at 2,299 naira 99 kobo, and Coke, Fanta, or Sprite 500 ml PET bottles at only 144 naira 99 kobo each. Don't miss out on Shoprite's low price birthday boom. Offers valid to the 4th of September 2022. Shoprite, lower prices you can trust always.
Dear Lagosians, let's continue to make our dear state safe and secure for all. Your government banned Okada in 6 local governments and 9 local council development areas. Accident and crime rates have gone down in these areas. We need to leverage this success to keep the numbers down. Therefore, the Lagos State government hereby bans Okada in 4 more local governments, which are Koshofe, Shomolu, Mushin, and Oshodi Solo, as well as their local council development areas, Ikosi Sheri, Agboiketu, Isolo, Ejibo, Odiolowo, and Bariga. Lagosians, the government values your lives as much as you do. Do not ride Okada. Use alternatives such as first and last mile buses and the medium and high capacity buses. The waterways with our 21 ferries are also safe and fast. Remember, Okada is banned from all major roads, highways, and bridges throughout Lagos State. Both riders and passengers will face the wrath of the law. This message is from the Lagos State government.
Football's biggest season is here, and DSTV is the stadium with all the action. Enjoy every single match from the FIFA World Cup, the Premier League, La Liga, Serie A, the UEFA Europa League, and the UEFA Champions League. That's all the stars from around the world in every competition that matters. Get DSTV HD decoder, dish plus 1 month compact subscription now for 12,000 naira only, and be part of sports' biggest stadium. Only on DSTV. T's and C's apply.
Believe and win big. Experience the wonder of the FIFA World Cup in Qatar with Coca-Cola. Buy any Coca-Cola product with a white cap. Check the code under the cap and dial *8014 *1 code hash to participate for free. You could win an all-expense paid trip to the FIFA World Cup in Qatar. There's also 250 million naira in airtime to be won instantly. T's and C's apply. Coca-Cola, official partner of the FIFA World Cup. This promo is approved by the FCCPC.
Hi, son. How are you and my daughter-in-law?
We're good. Thanks, Dad. There's something I've been willing to talk to you about.
Okay, I'm listening.
Rose and I are relocating back to Nigeria, and we're looking to get a home somewhere safe to start our family.
My son, Leisure Court Limited has exactly what you need.
Really?
I'm telling you, and their newest estate, King's Court, located at Orchard Road, is the best place to start a family. The estate comes with swimming pool, children's play area, 24/7 electricity, and security. With just 75 million naira, you can get a 4-bedroom terrace plus a BQ in a premium location.
Dad, Are you for real?
They even have a convenient payment plan. 30% initial deposit, 20% after 6 months, and another 20% after 6 months, and then 30% on completion. You are assured a home, just like me.
How do I reach out?
You can call them on 081 1111 3267 or 091 5458 7122, or visit them at 3B Onikepo Akonde Street off Admiralty Way, Lekki Phase 1. Leisure Court, excellent housing solution.
Hello? James, look, I'm on the expressway. My car just broke down. I don't even know what to do.
Sorry, you do not have sufficient credit to continue this call.
Oh, please, no.
Why not?
This is an important call.
Then you should have recharged.
I would, but I'm in a position where I can't.
Why not borrow some credit then?
Borrow credit? How?
With Glow Borrow Me Credit, you can borrow airtime and pay later. It's easy. Just dial *321# and follow the instructions.
Wow, that's fantastic.
Glow is always there for you when it matters most.
Sorry, James. As I was saying, my car just broke down now, and I have no help here.
Talk now, pay later with Glow Borrow Me Credit.
Glow Unlimited.
InDriver is the app that lets you negotiate your fare before your ride, and it works really simple. Passengers offer a fare, drivers accept or make their own offer. In other words, great ride prices for everyone. Download the app and take your first InDriver ride today. The InDriver online passenger transportation aggregator is not a taxi service. Find more information at www.indriver.com.
99.3 Nigeria Info, your number one station for talk. Let's talk.
The nation's number one talk station, 99.3 Nigeria Info. Yes, we are back from that break, and I know we're still having this very heated conversation as regards the brain drain in the health sector. If you would like to join in as a healthcare professional, please feel free to calling on our numbers 0700 993 993 993 and 01 465 7190. From some of the callers that we had earlier, even morticians are leaving. How bad can that sound, really? How bad, really? Honestly. Well, you can also contribute via Twitter at Nigeria Info FM. We're streaming live on Facebook. We're also live on YouTube. Nigeria Info 99.3 is how you can join. If you are in the diaspora and you're a medical practitioner or you work in that space, feel free to call our Skype ID, Nigeria Info FM. That's our Skype ID. We'd like to, get a thought or two from you as well. That's Nigeria Info FM on Skype. Good morning to you.
Good morning, Sheriff. Good morning.
Good morning to you.
Yes, medical practitioners and health workers. I think like you said, I really liked when you added lab sciences. If you notice, even on social media, there's now this continuous error in ordinary genotype and blood group of late. I've had a personal experience. I'm not a practitioner. I'm just a consumer of their services like everyone else. And even the nurse on duty did not know what faucet was. So it's obvious that most hospitals are training people on the job for something like your health. And like the doctor said, it's just better not to have any health issues because you're a disaster away from Nigeria happening to you. It's terrible. All the factors combined. Yeah. They are not well paid. The remuneration is poor. And that trauma of knowing that if you have the tools at hand, you can save this life, but the tools are not there. Some of my friends that are doctors I've spoken to, I think that's the height of it for them. Well, previously, it's not like they've been well paid before and it's suddenly poor. They have never been well paid. And before, it was just like they were managing because economy was slightly better and they still had a few tools to save lives. But now they don't have anything. They don't have gloves, as simple as gloves. Yeah. They don't have anything. And so you can save this life. You know that you can. But there is nothing at all.
Imagine how painful that can be. You know that you can do this thing, but there's nothing to help you do your job.
Some of my friends I've spoken to, that's really it for them. The fact that they can't stand it, that's very traumatic for them. And I don't even know where to start because I had a small experience of my little baby putting something in her nose.
Yeah.
And it took almost an hour to get it out. And it just by the fact that that doctor was even experienced, he could have gone another way.
Oh,
the nurses could not help. They just did not know what to do because they were learning on the job. So hospitals now, like, let me just put somebody there so that even my patients still come. So the government doesn't care. I think that one is not even debatable anymore. But the doctors, the nurses, all medical practitioners, lab scientists, these people that do scan and radiographers,
yes,
before they start mixing the gender of your baby, you cannot learn those things on the job. And so it's poor. It's the hype. And I don't blame them when they go to other African countries. You don't hear stories that are this bad. Nigeria has a long way to go, Sheriff. That's my contribution.
Thank you so much. Thank you for sharing. 8:36 Nigeria Info. Good morning to you.
Hey, good morning, Sheriff.
Good morning to you.
Hello, good morning, Sheriff.
Good morning, sir. I can hear you.
Good. Name is Adenose Patrick. I'm calling from Lekki.
You're welcome.
Thank you very much. I have like 4 that have left. And unfortunately, the government is not doing what they should do, just like several callers have said. Even if they don't want to leave, the tools to work with are not readily available because all of them at the helm of affairs can actually travel out and get good medical services. It's not only the doctors that are leaving. I remember way back in 1992, Sheriff, I organized a program for GM Nigeria where they had 500 vehicles. They sold 8 in 10 months.
Okay.
And within 2 weeks of the program that I put for them, they sold 492 cars. And GM America begged me for 6 months to relocate. I refused. This is 2022. I won't come out like yesterday.
Kai.
Good morning.
Kai. That's deep. It's very, very deep. Good morning to you. Good morning. You're live now on the radio.
Hello?
Yes, I know. Good morning to you.
Good morning.
Yes, ma'am.
Yeah, am I on to Nigeria Info?
Yes, you're live on the radio, ma'am.
Okay, yes. Okay, good morning. So I'm a consultant, right?
Yes, ma'am.
A medical doctor, I'm a consultant. And the thing is even more serious than you people know.
I can imagine.
As these specialists are getting trained, they are leaving the country, almost like they have even left before completing their training.
Wow.
It is so bad now that where I work, we have had to shut down some wards because there is nobody to man it. It is so bad. And patients come in and there is no bed space for admission. Not because there are no bed spaces ordinarily, but some wards have been shut down because there are no personnel to man it. And let me tell you, when I just graduated, I never thought of leaving Nigeria, because Nigeria was still good then. Now I am approaching my 50. And the only reason why I am not leaving is probably because I am older, right? And I think that, okay, what am I looking for at this age? Otherwise, I tell you, Sheriff, I would have gone because of the situation of this country. It's not encouraging. There's nothing to write home about. The hospitals are in shambles. There are there are no equipment to work with. You go to work and you are just sad because you know that you can do this, but what do you want to work with? It is too bad. And it will get to a point that people will come to the hospital and there will be nobody to attend to them. Or the few ones of us, the old ones, will be overworked. Honestly, it is even worse than you people know. And it is so bad because these politicians don't use hospitals in Nigeria, so they don't care. They don't care what happens to the ordinary man. That's the problem. That is exactly the problem. Until they start using hospitals in Nigeria, the health sector is not going to change. They won't care whether all the doctors and nurses are gone. They don't care because their children don't use there. They don't use there. They cough, they go to UK. They have whatever problem, they go to Germany, they go to US. That is the problem. So it's the Nigerian masses. Next year is coming. If they like, let them vote for another person that would even cause more problems. I think Nigerians should wake up. They should wake up. ASU is down, health sector is down, and it is even worse than you people think. I tell you, take it from me. I work in one of the
No
biggest
doubt at all.
federal hospitals in Nigeria. Yes, I'm not going to mention the name.
It's okay.
But I tell you
fine.
that it is worse than you people think. Thank you.
Thank you, ma'am, for that. Appreciate it a lot. Okay. Let's do this. Let me go to the social media and go take some messages. Ade George, I can see your call on Skype, but quickly let me take some messages and I'll come to the telephone lines and the Skype as well. Let's see. The brilliant ones are leaving. The result is that even medical results are wrongly interpreted. A friend of mine was nearly killed because of wrong interpretation of tests by lab technicians. You didn't leave your name, but thank you for your experience. You're sharing your experience. Let me see. This person is sending a message to me as if he was chatting with me. 11111. Let me jump for another one. Kenneth says, I just want you guys to confirm this. At general hospitals, if you're admitted and you spend a day on their bed, you are required and forced to pay for 5 days. What? I ask, why that? They told me it's compulsory. It happened to my 90-year-old dad a few weeks back. After spending so much on tests, scan, and close to a month before my dad was attended to. This is wrong. Meanwhile, at general hospitals, where whether you eat their food or not, you must pay for it. They served my dad very small 3 pieces of yam in the morning. I was crying for Nigeria. Kenneth is sharing that. Okay. I'm going to take just one more from WhatsApp. The most painful thing is that the Labour Minister, who is a medical doctor himself, keep telling us that they have more than enough doctors in the country. Alrighty. I'm back to the telephone now. Good morning to you.
Good morning.
Yes, please.
Yes. Am I on tonight? Nigeria?
Yes, you're on Nigeria Info, sir.
Okay. I want to comment on about medical personnel leaving the country.
Yes, please. Go on.
Okay. What I'm saying is that apart from the shortage of the number of the medical personnel, a lot of frustration, even in terms of setting up a facility by yourself and a medical personnel. And sometimes when you want to set up so many agencies, they will not come, this one, and they will also, like the experience I had in the place I'm working right now.
Okay.
We set up a facility like since last year. The government would keep telling us after completing all your registration, they say you have to register. I mean, you have to pay some of the millions to them, of which no any reason for it. You have to sign MOU to be remitting some money for them, like every after 6 months. Like, so frustrating in this country. And I thought COVID-19 could actually awaken our government to do the right thing. Like, they actually, some of them, they make money out of it instead. And they forget about everything. That's
Thank you. Thank you for sharing your experience. I'm going to speak with Ade George right now on Skype. Ade George, hi. Good morning to you.
Hello, hi. Good morning. Oh, thank you for taking my call.
Yeah, that's fine. Where are you calling us from today?
I'm calling from England.
Okay.
United Kingdom.
Okay.
Yeah. So I've been hearing quite a number of things that people have said. I think a lot of people have reiterated what I'd like to say. So I'm a medical doctor. I just came here last year.
Okay.
I've been practicing in Nigeria for just a little over 6 years.
Okay.
And I was the last to. I called on this show last week as well. I was the last to leave amongst my colleagues. Yeah. So you see, the issues for the brain drain for people leaving, I think is multifactorial. Anyways, people have different reasons for it. But I personally, it was more about job satisfaction. It wasn't necessarily about pay. I mean, I can count the number of times I ever saw a CT scan, for example, or an MRI scan in all my years. Practicing in Nigeria. But here it's like water. It's something that you have to do. For example, in Nigeria, if the patient comes in, you think they have a stroke, you know what to do. But first of all, how many people can even afford it? How many people can afford it?
Affordability.
Most people cannot. Exactly, that's another thing. How many people can afford it? Then our national insurance is not even that vibrant. It's piss poor. So at the end of the day, you go home, you're frustrated, you feel you know what to do, but then you can't. I keep saying it. See, Lagos is just a fraction. Go to other parts of the country.
Yeah.
You will really see what is going on, how terrible it is. So it's really, and what I feel we should talk about solution now. You see, I feel we are too docile for people, Nigerians. We are just too docile. How can healthcare is everybody's business?
It's everybody's
a baby that
business.
is born today, a baby born today. In fact, even from the womb, what are we saying? Antenatal, you need healthcare. So it is everybody's. So we need to hold our leaders more accountable. We need to hold them more accountable. I worked in a primary health care facility one time. One House of Assembly member walked in and everybody was running after, hey, honorable, honorable. And if you see the state of the healthcare, I thought people would even say, you are coming here. Look at all these places. Everybody wanted to collect money from me. He came with cameras and everything. And after he left, they turned on the doctor and said, hey, doctor, we don't have the doctor, And I'm like, you saw your representative come here. I expected you to challenge. I'm not saying you should rough handle anybody, but challenge, look at the health, look at how the place is. So we don't hold our people accountable enough. And this is just the beginning. More people will leave, not just doctors, nurses, med lab science, physiotherapists, everybody are finding their way out. So we need to hold these leaders more accountable. Like my one of the other callers said, when they have headache, they go to London. When they have stomach pain, they go to Paris. When they have back pain, they go to Dubai. So they don't care. They don't care. But even if they don't care, we still need to hold them accountable. We need to, any candidates, whether House of Assembly, governor, president, that does not talk about healthcare, let us not even look at their way at all. Thank you very much. That's what I have to say.
Ade George, thank you for calling from the UK. Let's head back to the telephone. Good morning to you.
Hello.
Good morning.
Good morning.
Yes, please.
Okay. I'm a consultant for many years now, and I'm still in Lagos. Apparently, because of age, one would have gone to. But I had this feeling and hope for Nigeria.
Okay.
I own my own hospital.
Okay.
But the fact is that most of the gadgets and machines we use, we have had to acquire it over time. But I tell you what, Sheriff.
Yes, ma'am.
Most times when Nigerians come, or when my people come, because Nigerians were the same, you will attend to them because of the trend of events or because of what is happening. They will hardly pay. Most of us complain, if you go here, if you go there, you will not see this, you will not see that. Well, perhaps my hospital is one of those that they will say it's very expensive because the gadgets are there, the machines are there. I work almost every day, even though I have two good doctors. I've been trying every day. I have to up their salary. Good lab scientists to up their salary so that they will stay over a period of time. But I tell you what, drugs in this country is another thing. Before the people that manufacture this country, these drugs, I don't want to give names, they used to bring to us. But these days you find out, because I have something to dictate drug abuse or wrong or outdated drugs. You find out if you don't do due diligence on those drugs, some of them are expired.
Wow.
And then if you don't do due diligence, they will give you something that is maybe 2 weeks or 2 months to the time of expiration. How do you keep? It's frustrating, even when you have everything that could give everyone succor. They will now come in. Before I don't used to go into, they'll come to us. But now I've decided on my own at my age to go into the people that manufacture these drugs. Because I can't afford to have drugs in my hospital because of the kind of people that come. If you now say, okay, let me bridge it and attend to others, my mind and the doctors, other ones in the hospital, will not let us do it. But they will come, and if you come to my hospital, see bags and bags of uncleared checks. So they are saying everyone is going. It's not everyone that is going. There are those who want to work where there are machines and things to do. But can they pay? The only ones that really come and pay is these ones that are saying they are going to London. I tell you, there are some hospitals in Lagos. Unfortunately, they are not in other states that can really give you what you want. But they will not. These top ones or the middle one or the junior ones will come and beg you. Every day I get. You attend to them. Eventually, they say, "Please, I don't have money. I want to come tomorrow." I'll give. They would write checks, and it will not clear. How do you? Because all of us go to the same market.
Right.
If I don't own the hospital, the building I have, how do I manage? It can be frustrating. If you look the other side is the same. If you look the other side the same. It's not every hospital. Maybe we are one. There are 100 hospitals, for example. There are 2 or 3 that are like that. But even those who have, the payment is frustrating. Drugs are frustrating. Nigerians can frustrate you to want to close up.
Right.
I tell you, Sheriff, it's not. But all I know is that I will stay in this country.
Okay.
And I will know that because this is where my children and grandchildren have. We don't have any other place. Whether they're frustrated or not frustrated. I am one of those that say, please go and look for your voting card. That is the only solution. I am praying for this country that they will not frustrate me at my age because I'm a consultant this is my 46 years standing. So no one will frustrate me if they most times when I travel, I bring these gadgets. But you come to this country, you find out that you will not make ends meet because even human beings here will frustrate you.
Thank you, Ma.
But
Thank you.
It's good. It's just good. God bless Nigeria.
I'm glad that you've been able to share this angle as well, which is pretty much important. It's quite important. I know a couple of big facilities owned by private citizens this morning, and they are delivering world-class medical services. I know quite a number of them, and if you speak to them, the story is almost the same. Like it costs an arm and 1,000 legs. To keep their facilities open and to keep them functioning and to keep the doctors and nurses and other healthcare practitioners, working for them. Like the last caller said, it costs quite a lot to do that. Oof, okay. Let me take some messages because of time. Okay. I think I can squeeze in a couple messages here on our live stream on Facebook. Cynthia says, I'm a registered nurse. Imagine as a nurse, I have to cover up to 3 different hospitals in the name of local job because there are no nurses. I myself have resigned from hospital work. There are no personal protective equipment. I can't risk my own life, so I switched to aesthetics. Now I'm working in a medical spa where I don't have to come in contact with diseases for my safety. And I'm preparing for my NCLEX to USA. When I get there, I start practicing in hospital again. But to practice in this Nigeria, never. That's what Cynthia put here. Cynthia, thank you for sharing. And I have a whole stuff from other messages here, but I can't go further than this. Thank you all for being a part of this conversation. One of these days, I'll bring back Dr. Roberts again, and we'll have this conversation over again, because I think we're not having enough of these kind of conversations, and there are many of these kind of conversations, and we should have more because we are all in this. If anything happens to you, where would you go? To the hospital? Who would take care of you at the hospital when people are leaving the hospital? I mean, you just heard the last message I read right now. It's scary, honestly, but I would say don't be scared, don't panic, just make sure that you do the regulars, exercise, eat well, nourish your mental well-being by, reading books, something, educative, and hope for the best, that you don't fall ill. I'm Sheriff Quadry. Good morning to you.
Here on Info, we give you a great blend of all. Local or foreign, we've got you covered.
Blackouts across Nigeria as national grid collapses.
The UN is warning of the consequences of Russia's invasion of Ukraine.
We are right on. 99.3 Nigeria Info.
Your number one station for talk.
And I want to assume that you would run because I want to give the listeners context for the conversation.
In 2019, you were running mate to Atiku Abubakar. What did you learn then that you will not repeat this time?
Yes, when is the president coming out to address us?
There's a few things. One, I have a burden and a passion for young people.
The fact that you have elected a man does not mean then you begin to order him around. The president will do whatever is good for the country at any given time.
Mr. Adeshino, isn't the president responsible to the people?
What should the next president do to root out stakeholders who are complicit?
You fire those. Those that need to be fired are fired.
It's looking like a brand new Chelsea, attacking with so much fluidity. And what can you say about that, Martin? I know you follow Chelsea quite closely.
I live close to the Chelsea training ground. That's what you mean by that. I'm not.